Hi, this is Grace Hegel, and I'm going to be demonstrating making an occupied bed. So first, I checked the patient's chart, and I made sure this is the right room and the right scale at the right time. And then I've gathered my supplies. Then I'll knock on the door and ask if I can come in. And then I'm introducing myself to the patient. And then I'll provide privacy with the curtain. Then I will set my materials on a clean surface. And then I'll wash my hands and apply gloves. And then at this point, I will tell the patient what I'm going to do. I'm going to be making the bed, kind of just generally explain the procedure, and then ask if they're okay with that, any questions, etc. And then I will raise the bed to my working level, so I'm not injuring my back. Okay, and now, first thing I want to do is, at all times, you want to keep your patient covered because you don't want them to feel exposed. So, I will give them this bath blanket to use while I'm removing their sheets and such so that they feel comfortable and, like I said, they're not exposed. So then, at this point, I would take the blankets and the sheets off. And yes, they're both dirty, so I'm taking off the top blanket as well. Putting that in the hamper. Being careful not to let the soiled linen touch my body. And then also at this point, I would take the pillow, as long as it's safe for the patient to lay on the mattress itself, because I don't want to get the soiled pillowcase on the clean sheets. So I'd remove the pillowcase and not shake it so that I don't put dust or anything up in the air. And I'd put the pillow on a clean surface. And then I'd be informing the patient that I'll have to turn them to the side so I can make one half the bed. So I'd raise their legs to help turn them, and I'd support them with one hand on their hip and their shoulder, and on the count of 3, I'll help them turn to the side. 1, 2, 3. And again, I'm making sure to not expose them so the blanket is covering them. And they can hold on to the side rail if they need that to keep themselves to the side. Okay, and then I will take my fitted sheet and the incontinence pad, if you use one, or the or what they sometimes refer to as the draw sheet. And we don't have one on the bed now, but if we did, we would roll this up at the same time. So I actually grabbed this too early that I don't need to, but and as I'm doing this too, I'm making sure, and I'm checking the bed and making sure there's no belongings like earrings, necklace, glasses, anything like that. I'm making sure that's not in the bed. And then I'm making sure the bed is not wet or anything, because if it is, then I will want to spray down the mattress and clean the mattress itself. But that's all fine, so we can just roll it in normally. Okay, so we have the bare mattress, so now we can put on the fitted sheet and the draw sheet and our incontinence pad. And And then I'll want to bring that up to meet the half where I folded the dirty linen so that the patient can roll over and I can do the other half. And then as we're making the bed, we want to make sure that there's not there's as many minimal wrinkles as possible, because you don't want to create the possibility for an ulcer or anything like that to form on the patient. So you want everything to just be nice and smooth. And then I'm putting the draw sheet down. And this will be where the patient's perineal area is, so that if there is incontinence, this will catch that. So that at this point, I would put the other side rail up, because I'm going to turn the patient to my side, and I'd tell them what I'm doing. I'd tell them that they're going to feel the lump and that they should roll over that, and then they'll come over to the side, and I'll do the other half of the bed. So again, we'll grab their shoulder and their back to support them, and 1, 2, 3, put them to their back, make sure they're okay. Get the blanket out for underneath them. Okay, and then again, raise their legs so you can turn them easier. Grab by the shoulder and the hip, and 1, 2, 3, turn. Making sure they're not exposed, and they're handing them to the side rail, they're safe. Okay. And then we can do the other side. So I can put this down because they're not over here anymore. And then, so now I'm pulling off the dirty linen. And I'm rolling it from the head to the toe. Inside out. Putting that dirty linen. And then here's my clean fid sheet and the draw sheet, and I'm pulling that over, again nice and tight. Try to get rid of all the wrinkles, and then roll this over. Okay, and then at this point I have the clean sheets on so I can do the pillowcase so that the patient doesn't have to lay without a pillow anymore. And then again, I'll want to do this without shaking the pillow around, so I'm going to fold in half so that I don't have to shake the pillowcase as I put the clean pillowcase on. Okay, then I'm just tucking in the edges so that it just looks nice. And then also, I didn't see the tag, but if there's a tag, you'd want the tag in this way so it's not scratching the patient or anything. And then there's the pillow, and then I'll put this back up because we're going to roll the patient back on their back. And then same procedure, shoulder and hip for support. 1, 2, 3. Okay, roll them over onto their back. Again, make sure they're comfortable and all. And then now I can put on the sheet and the top sheet again. And when you put on the top sheet, you'll want it so that the soft side is touching the patient, so that, because it's softer and you want the patient to touch the soft side. So we'll put that over. And then again, I can put these down because I'm not going to roll the patient anymore. And then same thing with the sheet and the blanket, is you can do the half and half to save time. And again, avoid shaking the linens open because you don't want anything flying in everywhere. And it's just obnoxious too. So, okay, so I've got half of it unrolled, and then I'll go to the other side of the bed. and pull that down. Okay, and now the tricky thing about the sheet with and the blanket with the patient in is you also want as minimal wrinkles as possible, but you don't want too tight on them because that will also put sores and make it hard for them to move. So make sure all the time that they have room by the toes, for example, so that doesn't cause any friction or ulcers. And make sure it's just like a comfortable space to move, but not, you just don't want too baggy if possible so that, like I said, so the sores don't form. But yeah, so we're putting the sheet, all that is over them, and then the top, just to pretty much just make it look nice, we fold the top sheet, just the top few inches over the top of the blanket. And then at this point, the patient is not exposed anymore because they have the blanket, so you can take the bath blanket, and they would hold that as you're pulling this down so that they don't get exposed. And again, I'm doing the half, so I'm pulling it to the half. And then we're done with that, so we can put that in the dirty lenses as well. Okay, so we'll just pretend that this looks all nice and perfect, and then when you're comfortable with how the sheets are laying and such, your last step is to make the mitered corner on the end here, and then all that is you pull a blanket over the top, and you make your little triangle like that on the top, and then you put all the things underneath, tuck that in, and then it can just lay down like that, and then you do it on the other side. In the triangle, tuck it in again, and you're done. It looks so beautiful. And then at this point, you would just do your standard post steps, so lower the bed for the patient's safety. Okay, and then I make sure that they have their call light. I make sure that the patient is comfortable. Ask if they need anything, like if they're doing okay and stuff. Make sure, you know, I've cleaned up the clutter and the room is okay and free of trip hazards and such. And then I would wash my hands, and then I would record what I've just done so that people know, and that's it.